You step into the shower. The water turns ice cold. Your skin screams. Your chest tightens. Your heart does not politely adapt. It panics. Pay very close attention to this next part. Most general practitioners actually get this wrong. After age 65, your body no longer handles sudden cold as stress. It handles it as a threat, a real one, a biological ambush that hits your nervous system, your blood vessels, and your heart rhythm in the same second. This is the morning mistake. You think cold showers are healthy. You heard they boost circulation. You heard they toughen you up. You heard athletes do it. You heard a podcast host say it resets inflammation. None of that applies to your aging cardiovascular system. When freezing water hits your skin, millions of cold receptors fire at once. These are not vague signals. They are A-delta nerve fibers, fast, sharp, unforgiving. They shoot electrical impulses straight into your spinal cord and up to the brainstem. The brainstem does not negotiate. It triggers the sympathetic nervous system. This is the same system that fires when a car swerves into your lane. Adrenaline floods your bloodstream. Noradrenaline follows. Your heart rate jumps. Your blood pressure spikes. Not gradually, instantly. In a 20-year-old, arteries stretch and absorb the surge. In you, they do not. Your arteries are stiffer now. The elastic fibers have been replaced with collagen. Collagen does not stretch. It resists. So pressure rises even higher. Your coronary arteries constrict. This is called cold-induced vasoconstriction. Blood flow to the heart muscle drops at the exact moment the heart demands more oxygen. That mismatch is lethal. You feel it as a punch in the chest, a sudden breath catch, a wave of dizziness. Many seniors ignore this. They say it passes. They say it is just shock. It is not shock. It is ischemia beginning. Now listen carefully. Cold exposure also triggers something called the diving reflex. Your face senses cold. Your vagus nerve activates. Heart rate slows abruptly. Yes, slows. At the same time, adrenaline is screaming for it to speed up. This is electrical chaos. One signal tells the heart to race. Another tells it to brake. The conduction system does not like mixed orders. This is how atrial fibrillation starts. This is how ventricular ectopy appears. This is how a previously stable rhythm turns erratic in seconds. I have seen patients collapse in the shower with no warning. No chest pain, no drama. Just a sudden loss of consciousness. Slippery floor, head trauma, cardiac arrest. And here is the part no one tells you. Hot to cold is worse than cold alone. When you start with warm water, your blood vessels dilate. Your skin vessels open wide. Blood pools near the surface. Then you flip to cold. The vessels slam shut. Blood is forced back to the core in a violent surge. Blood pressure skyrockets. The heart is suddenly overloaded. This is called a preload and afterload spike. It is mechanical stress on a heart that may already have microscopic scarring you do not know about. You think you would feel a warning if your heart were vulnerable. You are wrong. By age 65, the heart's electrical insulation deteriorates. Fibrosis creeps into the conduction pathways. Signals slow. Detours form. This is silent. You feel nothing. Cold shock exploits this weakness. Now pay attention. This is where it turns deadly for seniors with normal checkups. Your doctor listens to your heart. It sounds fine. Your resting ECG looks fine. That does not test cold stress. That does not test sudden autonomic swings. That does not test what happens when your blood pressure jumps 40 points in 5 seconds. Cold showers do exactly that. Your carotid arteries sense the pressure spike. Baroreceptors misfire. The brain tries to compensate. Heart rhythm wobbles. You feel lightheaded. Your vision tunnels. You grab the wall. Some do not grab in time. This is not rare. It is underreported. Shower deaths are often labeled as falls. The trigger is missed. Now here is a brutal truth. The healthier you think you are, the more likely you are to attempt cold exposure aggressively. You stay in longer. You breathe deeper. You force it. That prolongs sympathetic activation. That prolongs coronary constriction. That prolongs electrical instability. This is not resilience training. This is provocation. Every winter, emergency departments see an uptick in unexplained arrhythmias in older adults. Early morning, after bathing, no infection, no drugs, no warning. Cold exposure is the common thread. You may think you would feel severe pain if something were wrong. Another mistake. Ischemia in seniors often presents as nausea, jaw tightness, fatigue, or confusion. Not pain. Cold showers mask these signals because the skin sensation overwhelms everything else. Your heart is starving while your skin is screaming. Now listen very carefully to this next sentence. If you have high blood pressure, diabetes, prior smoking history, sleep apnea, or are on beta blockers, cold showers increase risk dramatically. Beta blockers blunt heart rate response. The heart cannot compensate. Pressure rises further. Rhythm destabilizes faster. Diabetes damages autonomic nerves. Your compensatory reflexes are delayed. You overshoot. You crash. Sleep apnea already primes your heart for arrhythmia. Cold exposure pulls the trigger. This is the emergency. You do this alone. Behind a locked bathroom door. Early morning. No one hears you fall. And here is the curiosity gap you need to hold on to. There is one specific cold shower habit that multiplies risk more than all others. Almost every senior who tries cold exposure makes this exact mistake without realizing it. In the next part, I will show you exactly how your vascular tree reacts second by second and why that one habit turns a cold shower from stress into catastrophe. Now, pay very close attention to this next part. Most general practitioners actually get this wrong because they never visualize what is happening inside your vessels. Picture your vascular tree, not abstractly, physically. From your heart, the aorta exits like a thick fire hose. In your 20s, its diameter was wide, elastic, and smooth. The inner lining, the endothelium, was slick like wet glass. Blood slid through with almost no friction. Now you are in your 60s or 70s. The aorta is stiffer. Its diameter has narrowed by millimeters that matter. The elastic lamina has fragmented. Calcium has settled into the wall. The endothelium is no longer smooth. It is pitted. Microscopic scratches. Tiny plaques that do not block flow at rest but distort it under stress. Image: aorta cross-section showing stiffened wall and endothelial roughness. Blood leaving your heart no longer flows. It pulses. Each beat sends a pressure wave that reflects back faster because the vessel walls cannot absorb it. This is called increased pulse wave velocity. When cold water hits your skin, the sympathetic nervous system fires. Peripheral arterioles constrict. These are the small resistance vessels. Their diameter drops fast. Resistance skyrockets. Your heart must now push against a suddenly closed system. This is afterload. The left ventricle thickens over decades to compensate. That thick muscle needs oxygen. Coronary arteries supply it. Here is where the danger concentrates. Your coronary arteries are narrow to begin with, 3 to 4 millimeters wide. The inner lining is exquisitely sensitive to catecholamines. Cold exposure causes alpha receptor activation. The arteries constrict. Even a 10% reduction in diameter cuts flow dramatically. Image: coronary artery constriction during cold exposure. Blood flow to the heart muscle drops at the same moment blood pressure spikes. This mismatch creates subendocardial ischemia. The inner layer of the heart wall starves first. It is the most vulnerable. You do not feel this as pain. You feel it as unease, weakness, a strange pressure, sometimes nothing. Now move upward. Your carotid arteries feed your brain. They have baroreceptors embedded in their walls. These receptors measure stretch. When pressure surges, They fire signals to slow the heart and dilate vessels. Cold confuses them. The vessels are constricted by sympathetic tone, but pressure is high. The brain receives mixed data. The vagus nerve activates suddenly. Heart rate drops. This is the second half of the trap. Image: carotid sinus baroreceptor signaling. Your heart's electrical system sits in the middle of this storm. The sinoatrial node sets the pace. The atrioventricular node delays the signal. Fibers carry impulses through tissue that is no longer uniform. Fibrosis creates dead zones, signals detour, timing shifts. Cold-induced autonomic swings exaggerate this instability. That is how atrial fibrillation begins. Atrial tissue quivers instead of contracts. Blood stagnates. Clots form. Stroke risk rises silently. Now go lower. Your skin vessels are massive reservoirs. When warm, they hold a large volume of blood. When cold, they expel it. Hot to cold forces a rapid central volume shift. This increases preload. The heart fills suddenly. Stretch receptors fire. Another reflex engages. Too many reflexes. Too little time. Image: blood volume shift from skin to core. Now here is the habit I warned you about. Most seniors start the cold water at the head and face. This is the single most dangerous choice. Cold receptors around the trigeminal nerve trigger the diving reflex instantly. Heart rate drops sharply. Blood pressure rises simultaneously. Bradycardia plus hypertension is a lethal combination for an aging heart. Your myocardium receives less oxygen while pressure inside the chambers increases. Electrical instability follows. You feel it as a sudden gasp, a sharp intake of breath. That gasp further stimulates the sympathetic system. The cycle tightens. Now consider the vertebral arteries. They run through the neck vertebrae. They are sensitive to spasm. Cold exposure to the neck increases spasm risk. Blood flow to the brainstem dips. Dizziness, black spots, loss of balance. Image: vertebral artery spasm with neck cold exposure. This is why shower collapses often occur before any chest pain. The brain loses perfusion first. Now understand this. None of this requires severe coronary blockage. None of this requires prior heart attack. None of this shows on routine tests. It requires stiffness, endothelial damage, autonomic aging, normal aging. Now pay attention to this next part. Most advice online tells seniors to breathe through it. Controlled breathing slows heart rate further. In this context, that is dangerous. You are already bradycardic from the diving reflex. Further vagal tone can push you into pauses. 5 seconds, 6 seconds, enough to lose consciousness. Your heart does not stop dramatically. It hesitates. Blood pressure drops. Gravity wins. Now here is the curiosity gap. There are external signs on your body that reveal whether your vessels and nerves are already compromised. Signs you see every day, but dismiss. In the next part, I will show you exactly where to look. Your skin, your hair, your nails. They are warning flags you have ignored for years. You look at your body every day. You think you know it. You do not. Your skin, your hair, your nails are diagnostic surfaces. They reflect blood flow, oxygen delivery, nerve integrity, and hormonal balance. Long before your heart fails loudly, these tissues fail quietly. Pay very close attention to this next part. Most people never connect these signs to cardiovascular risk. Start with your skin. Run your fingers over your forearms, over your shins, over the backs of your hands. Is it thin, papery, fragile? This is not just aging. This is microvascular compromise. The small blood vessels that feed your skin are the same class of vessels that regulate blood pressure during stress. When they degenerate, your ability to adapt to sudden cold collapses. Look at the color. Mottling. Patchy paleness. A bluish tinge when you are cold. That means poor vasomotor control. Your vessels constrict too hard or too late. Cold exposure exaggerates this instability. Image, mottled skin from impaired microcirculation. Now look at your lower legs. Shiny skin, loss of hair. That is not cosmetic, that is chronic hypoperfusion. The arteries are not delivering enough blood even at rest. If your legs struggle, your heart struggles harder under stress. Cold showers demand rapid redistribution of blood. Your system cannot execute it smoothly. Now your hands. Cold fingers that take long to warm. White or purple fingertips. This is Raynaud-like behavior. It reflects exaggerated vasoconstriction. Cold exposure amplifies this response system-wide. Coronary arteries are not exempt. Image, cold-induced vasoconstriction in fingers. Now your nails, vertical ridges, slow growth, brittle edges. Nails are metabolically active tissue. They require constant blood supply. Slow growth signals reduced perfusion. Brittle nails reflect protein synthesis stress and hormonal shifts that accompany vascular aging. Now your hair. Thinning at the shins. Thinning at the temples beyond genetics. Hair follicles are oxygen sensitive. They shut down when supply drops. This is not vanity. This is a map of your circulation. Now move to sensation. Do you feel tingling, burning, numbness in your feet or hands? This is peripheral neuropathy. Often blamed on age, often blamed on posture. In reality, it is nerve ischemia. The nerves that sense cold and regulate blood vessel tone are damaged. Cold showers hit a nervous system that cannot coordinate response. That is how blood pressure overshoots. That is how heart rate lags. That is how syncope happens. Now pay attention to healing. Do small cuts take weeks? Do bruises linger? That means poor microcirculation and impaired inflammatory response. Cold exposure further suppresses immune and repair mechanisms transiently. In seniors, recovery is delayed. Now consider your morning symptoms. You stand up and feel dizzy. You need a moment to steady yourself. This is orthostatic intolerance. Your autonomic system already struggles with pressure shifts. Cold showers create the most violent pressure shift you can induce voluntarily. Now here is a critical connection most people miss. These signs correlate with endothelial dysfunction. The endothelium is the single cell layer lining every vessel. It releases nitric oxide. It controls dilation. It prevents clotting. When damaged, vessels constrict when they should relax. Cold exposure demands endothelial cooperation. Without it, constriction dominates. Blood pressure spikes. Coronary flow drops. Electrical instability rises. Image, healthy versus dysfunctional endothelium. Now listen carefully. If you recognize 3 or more of these signs, your cold tolerance is already compromised. You may have been getting away with it for years. That does not mean you are safe. It means you have not yet crossed the threshold. Cold exposure does not build resilience in damaged systems. It exposes weakness. Now here is the curiosity gap. There is a simple home protocol. 3 steps. No equipment, no cold exposure required. It tells you, with brutal clarity, whether your heart and vessels can tolerate sudden temperature shifts. Most seniors who try it are shocked by the result. In the next part, I will give you that protocol. Exact steps, exact timing, exact interpretation. Now pay very close attention. This is not a wellness trick, this is a stress probe. It reveals how your cardiovascular system handles abrupt change without exposing you to cold shock. 3 steps, exact order, no shortcuts. If you rush this, the data is useless. Step 1. Baseline control. Sit in a chair with back support. Feet flat, hands resting on thighs. Do not cross your legs. Sit for 5 full minutes, not 2, not 3. During this time, your heart rate and blood pressure settle into a true baseline. This matters. At the end of 5 minutes, notice 3 things. Your heart rhythm. Is it steady or irregular? Your breathing. smooth or shallow, your mental clarity, calm or slightly foggy. These are baseline autonomic markers. If you already feel lightheaded or unsettled, stop here. Your system is unstable at rest. Step 2. Peripheral cold stimulus without shock. Take a bowl. Fill it with cool water. Not ice, cool tap water, about 15 to 18 degrees Celsius. Only immerse your hands, up to the wrists, not the forearms, not the face. This isolates peripheral vasoconstriction without triggering the diving reflex. Start timing. Hold for 60 seconds. Now observe. Within 10 seconds, your fingers should feel cold but tolerable. By 30 seconds, discomfort increases. By 60 seconds, your body should adapt slightly. If instead you feel pounding in your chest, breath hunger, dizziness, or anxiety, that is abnormal. That is exaggerated sympathetic response. Now remove your hands. Here is the key observation. Your fingers should regain color and warmth within 2 minutes. If they stay pale, blue, or numb longer than that, your microvascular recovery is impaired. That means cold showers will trap blood in the core and starve the periphery violently. Step 3. Orthostatic challenge. After your hands recover, stand up smoothly. Do not brace. Do not grab furniture unless you must. Stand still for 1 full minute. Notice again. Heart rhythm, vision, balance. A healthy system stabilizes within 10 seconds. If your vision dims, your heart races or pauses, or you sway, your pressure regulation is already failing. Now here is the interpretation most doctors never explain. If step 2 triggered chest awareness or step 3 triggered instability, your heart cannot handle rapid vascular shifts. Cold showers create far more intense shifts than this test. This test is mild, controlled, safe. Cold showers are not. Now listen carefully. Many people pass step 2 but fail step 3. That means their vessels constrict, but their autonomic system cannot reallocate blood fast enough when posture changes. Cold showers plus standing upright is the worst possible combination. Now here is a critical warning. Do not repeat this test daily. This is diagnostic, not training. Your goal is information, not adaptation. Now the curiosity gap. Even seniors who fail this test are told cold showers are fine if they ease in. That advice is dangerously incomplete. In the final part, I will dismantle the biggest cold exposure myths, explain what changed in medical guidance by 2026, and show you exactly who should never use cold showers again. Now pay very close attention. This is where most advice collapses into half-truth and outdated dogma. Myth 1. Cold showers strengthen the heart. They do not strengthen aging myocardium. They stress it. Cardiac muscle adapts to progressive load, not sudden shock, not autonomic whiplash. Cold exposure delivers the opposite of controlled training. It delivers chaos. Young hearts absorb chaos. Older hearts fracture under it electrically. Myth 2. If you ease in, you are safe. Easing in reduces skin shock. It does not prevent coronary constriction. It does not prevent carotid baroreceptor confusion. It does not protect a fibrotic conduction system. The danger is not how cold the water is. The danger is how fast your autonomic system must decide. Myth 3. If your doctor did not warn you, it must be fine. Most primary care training still frames cold exposure as benign. That guidance lags physiology. Cold-induced arrhythmia risk is not screened for. It is not coded. It is discovered after collapse. Now the medical reality as of 2026. Cardiology societies now recognize autonomic instability as a major contributor to unexplained syncope and atrial fibrillation in older adults. Wearable data changed this. Continuous rhythm monitoring revealed spikes in arrhythmia following cold exposure, early morning bathing, and winter temperature transitions. This is no longer anecdote. It is pattern. Medicare coverage shifted accordingly. As of 2026, extended ambulatory rhythm monitoring is more broadly approved for seniors with unexplained dizziness, falls, or near syncope. Even without documented heart disease. Why does this matter? Because cold shower-induced events were hiding inside the category of mechanical falls. The cause was misclassified. The trigger was missed. Now understand this clearly. If you have any of the following, cold showers are no longer a rational risk. Hypertension, treated or untreated. History of irregular heartbeat, even once. Diabetes or prediabetes. Neuropathy, sleep apnea. Carotid artery disease, beta blockers or rate-controlling medications. Unexplained falls, morning dizziness. That list includes most people over 65. This is not fear, this is probability. Now here is the mistake that keeps repeating. People conflate discomfort with benefit. Cold showers feel intense, intensity feels productive, productivity feels healthy. Your cardiovascular system does not reward intensity, it rewards stability. Now the final truth. Cold exposure has benefits when applied to systems that can recover quickly. Muscle, inflammation, young vasculature. Your system is different now. Your priority is rhythm stability, pressure control, cerebral perfusion. You do not need shock, you need predictability. Now lock this in. The most dangerous place to experiment with stress is alone, upright, and wet. That is the shower. If you want temperature therapy, it must be seated, brief, peripheral, and controlled. Not full body, not facial, not sudden. And here is the final retention loop. In the next deep dive, I will expose the single morning habit that silently raises stroke risk after age 70. It is not salt, it is not sugar, it is not caffeine. It is something almost every senior does within 10 minutes of waking.